since 1989, has been working in access to public health from a human rights perspective centered on HIV, other infectious diseases, and sexual and reproductive rights. Since I left in 2017, my previous work as executive director of the foundation has been involved in the civil society international healthcare movement in the yearly G20 and G7 groups, as well as in the CSEM advisory group. Besides other more specific regional networks focused on HIV, as well as a board member of Coalition Plus, a francophone worldwide network of about 50 civil society organizations. I have a strong belief that although our governments, which are increasingly authoritarian throughout this unequal world, are shrinking our space as much as they can, civil society has the duty of raising its voice on behalf of the most vulnerable and all those that should not be left behind. To achieve the long-time Alma Ata commitment, Health for All, it is important to understand that One Health, or UHC, in 2030 are not only acronyms. They mean not only healthcare, but also access to nutrition, wash, medical assistance, human rights, and well-being for everybody and everywhere. We have just gone through a pandemic that proved that nobody, nowhere will be safe until we are all safe. But it also presented openly existing inequality, where some rich countries had wide and fast access to life-saving medical systems and vaccines. Most of the global South countries suffered millions of unnecessary deaths. 2 years after the pandemic crisis, today we know that billions of COVID-19 relief funds have been misspent or wasted, while nearly 2 billion people still face catastrophic health situations, living with and dying from preventable and treatable disease. In Fundación Huésped, we believe that adequate community participation is necessary for the development of strategies to advocate and improve the access to rights. We work for a society free of stigma and discrimination, in which all people have access to whatever they need, and equal access and healthcare, and where public policies are based on scientific evidence. We understand that shaping priorities for social participation in health issues is the way to change reality. Therefore, we proudly participate in the SPHERE project, a long-term project aiming to advance social participation and enhance advocacy and engagement capacities to shape universal health policies for the transgender community and sex workers, whose health care access in Argentina and many other Latin American countries is currently not guaranteed. Social and community participation have already a significant formal improvement in rights recognition in our country. But however, there are still many obstacles in the access to healthcare, often related to the stigma and discrimination that these populations suffer. The implementation of the SPHERE project provides an opportunity to reduce these barriers and promote effective participation of communities in the promotion of universal health coverage. And the project implies research studies to update evidence that shows the reality of these communities, so as to have a better understanding of the situation and needs, and the possible availability for them to participate in the design and implementation of health policy, the promotion of new strategies, a legal framework, and the access to according public health policies. Having presented what we expect to achieve as Fundación Huésped with this project, let me introduce David Paris from the George Institute, who will moderate the following consultation. Thank you very much.
Thank you, Kurt. Thank you very much for setting the scene, and it's very exciting to join you all. My name's David Pierce. I'm the acting chief scientist at the George Institute, and I lead our global primary healthcare program. And Kurt mentioned the Sphere project, which is one of the collaborations that we're very excited working with Fundación Huésped on that project and taking forward some of those priority activities that he outlined. So my job's to keep us to time for the next 50 minutes. Hopefully we can achieve that. And the order of the day is, as you can see on the slide there, is we'll have two 10-minute presentations from our speakers, and then really the floor is yours for the remaining half an hour, where we want to hear your perspectives, either in the chat or please feel free to unmute and come off mic and give us your thoughts, and then I'll pass over to Laura to close the session. So we'll just keep things moving along, and without further ado, I'd like to introduce Nanut Matroput who's the head of the Global Collaboration Unit in the National Health Commission office in Thailand. Over to you, Nanut.
Thank you very much indeed, and I feel like honored to speak to CSO and NGOs globally, as Thailand support social participation for a long time ago. And we started this agenda around 1970s and 1980s by engaging villagers into healthcare delivery and building their capacity on that. And this becomes village health volunteer. And they are the backbone of the healthy system in Thailand, especially during COVID-19 pandemic. And because of the strength and capacity of villagers, civil societies, and NGOs, we further develop local health funds and health promotion funds that empower people to manage their health activities. And further on, we set up a policy development platform called a Health Assembly that engage people in the policy development process to work equally with the government officials and academia. A Health Assembly is not public hearing forums, nor consultative meetings. Apart from voice out their concerns, the participants have to join in implementing policy recommendations together with government officers too. And Thailand has provincial health assemblies and the National Health Assembly. We organize the National Health Assembly annually now for 15 years. We are fortunate to have institutionalized social participation for many decades. And during COVID-19, the government measures on COVID-19 prevention and response were enhanced and supplemented by social measures from villagers, civil societies, and NGOs. And this helped Thailand survive from the pandemic. And social participation also benefit to universal health coverage, primary health care, and health security. Thailand has valued social participation and realized we need to invest social participation before the crisis. And we therefore would like to pursue this agenda to World Health Assembly next year. Thailand, together with Social Participation Technical Network, have been working on and advocating this agenda long before the pandemic. Handbook on social participation is part of our contribution. And last March, WHO Southeast Regional Office organized the regional consultation on social participation based on the WHO technical background paper on social participation. And last May, Thailand organized the national consultation. It is interesting that the issue of monitoring, evaluation, and reporting system on social participation was raised up in Thailand. And I think this is the right timing, not only for Thailand, but also for the member states to walk the talk social participation and make it happen before the next pandemic. And I am happy that Thailand doesn't walk alone. Slovenia, France, Brazil, and Tunisia walk with us. And the inputs from you today will be very useful if we can help World Health Assembly resolution on social participation. This will be a doable resolution. Thank you very much from me.
That's great. Thank you, again, for setting the scene, and particularly the Thai experience. It's always inspiring to hear the achievements that have been made in Thailand. You've done so well with keeping to time. We could take a question from the floor or a comment from anyone. If you'd like, just put your hand up with the hand function and ask your question, or else post it in the chat. I'll give you a minute if anyone would like to ask anything. Still getting warmed up.
If it is perhaps I mean, we have to warm up, but we also plan to organize, we call it USC in Journey for Thailand workshop, and particularly on social participation around November this year, but mostly for Asia people. But if anyone would like to join in, I will write the email address on Q&A on chat box, and you can contact me or my team, Kanita, as well. So you can apply that course.
Terrific. I mean, I might kick off with a question, if I don't mind. You mentioned about the importance of monitoring and evaluation for social participation. And I guess for us as an academic institution, we're always thinking about what are the right methods and metrics and mechanisms in which this can actually be done robustly. And do you have any thoughts on what are some of the principles around having robust monitoring and evaluation mechanisms?
I think, first of all, why we interested in this issue that come up from national consultation, because I think every organizations in Thailand accept that we need to have social participation. And I'm sure that all governments agree on this issue. But since there are no monitoring, no evaluation, and no reporting system, so we cannot improve the quality of social participation. So that's why they raise up. But in terms of methodology, I know that it's very difficult if we want to do globally. But by the way, the handbook, WHO handbook on social participation can be a starting point that we can analyze from that. For example, maybe we can look on inclusiveness of the participation in governance, things like that.
Yeah, great, thank you. We'll just take two quick questions. Orajit and is it Eli? Forgive me if I'm not pronouncing correctly, but Orajit first.
Yeah, thank you. I know Nanut and we work closely together before, and I also just would like to add some more information and question as well. Since I'm also working in the National Health Security Office before, USC system that we developed, and I can say that the USC, especially the National Health Security Office, work closely with the National Health Commission Office as well, and it can be the office can be established from the NGO movement that they have signature, about 50,000 signature in order to have the National Health Security Act. So I think that the USC in Thailand, the NGO, I mean social participation, have a major role and major voice, and they have 5 seats in the NHSO board. But what I would like to add more is from the recently that I organized with the APCASO. Maybe Nanut, you are the board of APCASO, right? If I correct. And then we develop, we can have, as I told you before, at the moment that we can have the Thai civil society from several vulnerable group and disability group to have their voice about USC. And this is something that they would like right now. APCASO try to have them feedback in the zero draft of the USC, WHO USC, and they would like to have it voiced out in September in the high-level meeting this September. So that is something that I think we also have to discuss about that. Thank you.
Great. Thank you. Eli, a quick question from you, and then we will need to move on to our next speaker.
Yes, thank you. I'm Elia from DRC, of course, Ahmed. One question to Narut of Thailand about the National Health Assembly. Is that event organizing by the civil society organizations or the government? The next question, civil society organizations are facing an issue of funding. What is the experience of Thailand or other speakers will tell us about founding or resource mobilization for civil society organizations about their participation? Thank you.
Right. The National Health Assembly is organized by the government, by my organization, the National Health Commission Office. Because when we decide my organization, we decide to have to be a platform that the government to work with the civil society or NGOs together with the academia, because we believe that if like the government is the authority power, civil society is social power, and academia is the knowledge power. If these three sectors work together, we are pretty sure that any difficulties or even the pandemic, we can solve it. So we provide this platform and many platforms and many tools to let these three sectors work together. We designed this platform or this concept 20 years ago. At that time, NGOs and government in Thailand, we hardly work together, to be honest. But because of the platform that make everyone equal, of course, at the beginning, NGOs we need to help civil society and NGOs get on board, build capacity for them. But at least for 15 years already, I think they are more equal in terms of rights and capacity.
We'll have to move on. That's the triangle that moves the mountain, right? Yeah.
Yes.
It's fantastic. Okay, thanks very much. We'll move on. And our next speaker is Lara Brearley, who's a consultant with WHO in the Health Systems Governance and Stewardship Unit. Over to you, Lara.
Thanks so much. And thank you, Nanut, for sharing your ambition and commitment to this agenda and the impressive progress that the country has made to date in Thailand. So thanks so much for having me today, and it's great to be with you all, and I'm excited to have so many people on this webinar. My name is Lara Brearley, as David mentioned, and I'm a consultant working with WHO, and I've been with them on and off for a while in Geneva and now remotely. But I'm here today to present to you some of the work that we've been doing and wanting to get your input and feedback on, which are these priority actions to institutionalize social participation. And we look at social participation from a governance point of view to feed into policy and decision-making processes. And these are typically the government-led health sector planning processes and reforms. I'll briefly give you a bit of the genesis of this work as part of the wider process, and then deep dive into the recommendations in the technical background paper to provide a basis for your discussion and feedback. Next slide, please. So this is a messy slide, apologies, but what we wanted to demonstrate was that this is a process over time and towards a bigger objective, and the bigger objective is really looking at kind of institutionalizing and effective meaningful social participation happening in countries at all levels of the health system. But the work, sort of this momentum started before, but I'll start with the handbook that was launched in May 2021. This was mentioned by Nanut, and this was a WHO product, and it really provides the normative basis for this work. I think my colleague Kira will put the links in the chat box as well to the documents I refer to as we speak. And since its launch, the priority has really been around how to improve implementation of the recommendations in the handbook. In August that year, August 2021, there was also the formal dialogues between the WHO DG, Tedros, and civil society. And one of the main agenda points was around social participation, and WHO agreed that we would champion this agenda, and that there was a discussion put forward by civil society that was informed by a wider network, which I'll come to in a minute, but around the ambition towards a resolution, and there was agreement that this could help to secure political will. There was also a plea from civil society that any process towards a resolution be more consultative than traditionally is done. So to produce the handbook, there was a network convened that Nanut referred to, which is the Social Participation Technical Network. And they remained intact following the launch of the handbook, with more emphasis on the advocacy for implementation of the recommendations. And they developed a strategy, and this included member states. So Thailand has been very active, Tunisia and others were also part of it. And there, this objective to pursue a resolution at the WHA was kind of articulated. And in order to try and help facilitate some consultation in the lead up to the member state closed process for drafting and negotiating on a resolution, we synthesized the recommendations of the handbook really into a technical background paper as the basis for consultation. And we've been trying to facilitate multi-stakeholder consultations, which have been at regional level with member states, particularly at global level with a survey and these constituency-specific consultations. And then Thailand also mentioned that they did a domestic consultation recently, a few months ago. We're also planning to see more regional consultations later this year, I believe, with member states in Europe, for example. And we've also seen in this period increasing references to social participation in resolutions and political declarations. For example, at regional committee levels, there have been primary healthcare and resilience resolutions with strong references to social participation. And we are seeing in early drafts of the UN high-level meeting on universal health coverage, political declaration, that there is hopefully going to be some strong content on social participation there and participatory governance. The pandemic high-level meeting is another one that we're watching and hopeful that there will be similarly strong language in that too. Next slide, please. So as I didn't mention, but the handbook was translated into multiple languages, and a video was also produced to help to try and convey the importance of this agenda and what it's about. The links are on there, but we can also put them in the chat. The next slide, please. So I won't go into too much depth on this, but the consultations have been happening and resolutions, as I mentioned, across different regions and articulated in ways that are region specific. But I think what we're seeing is growing momentum and a wave of support across regions for this topic. And the pandemic really accelerated that attention to the importance of social participation. The next slide, please. Nanut mentioned that there was a member state-led side event during the World Health Assembly, an informal side event on the Monday, the 22nd, which saw a kind of an announcement for the first time, I guess, of this political intention to pursue a resolution at next year's World Health Assembly by Slovenia, Thailand, and others. And they are now organizing. So in a way, the train has left the station. So now there's exciting momentum towards this resolution. And we are here with you today to try and help to identify what you would like to see as priorities within that language coming up. The next slide, please. So now to the technical background paper. Hopefully colleagues on this group have had a chance to take a look at it. And if you haven't, don't worry, we'll help to summarize some of the key messages in it now. But just a few points to make before I go into the content. One is that it's available online, and the survey is there as a vehicle for you to channel feedback. So please do share your thoughts, whether today on the call or in writing or both. But also that it's an opportunity to really help to shape this process, in that what we will be doing is updating the technical background paper based on the consultations, as well as summarizing the feedback received through the various consultations, to be available to the member states as they draft and negotiate the resolutions. So this is really hopefully an opportunity not to change the process per se for drafting a resolution, but to make sure that the voices of different stakeholders, and particularly civil society and communities, are heard by the member states as they go into their more formal process. So I don't think I need to convince people on this call about why social participation is important, but the background paper tries to articulate and make the case as to why it is. And this is, so we make three main arguments. One is that it's core to primary healthcare and necessary for universal health coverage. It empowers and amplifies marginalized voices, and that health policy strategies and plans better respond to the needs of vulnerable communities. The second is around fostering trust and health system resilience. We know from the pandemic, the more effective risk communication and emergency prevention and response happen when social participation is prioritized, and that trust a culture of trust comes over time, but that this kind of participatory governance can help to foster this trust, and it also improves population uptake of disease control measures. And we know that where existing mechanisms for participation are in place, these can be leveraged in the context of an emergency response. The third main reason why we say social participation is important for universal health coverage is that it advances health system accountability, so it promotes transparency, but it also can provide space for policy adaptation and recourse if there's poor performance or objections by community stakeholders and so on. The next slide, please. As the background paper then says, despite widespread endorsement of the principle, and in the box you've got a few of the global commitments to social participation that exist, there are various, but there's an endorsement of the principle of participatory governance, but there has been inadequate implementation. And one of the main obstacles to progress, we feel, has been political will, inadequate and unsustained political will to implement and maintain those reforms to institutionalize social participation. So all countries, we think, can do something to improve the quality of participation or to institutionalize it into governance mechanisms at all levels of the health system. Next slide, please. So we have articulated 4 priorities for country action to move towards institutionalizing social participation. The first is around investing adequate, stable, and predictable financial resources. The second is strengthening the capacities of government and facilitating capacity strengthening for participants. The third is ensuring sustained and regular participation, not ad hoc. And the fourth is monitoring and using data to evaluate participatory processes and the impact they're having on decisions that are made. Now, the background paper synthesizes a little bit of a case for each of these, or unpacks them slightly. But of course, the handbook has got a lot more detail and depth. So one of the challenges we have is what to carry from the handbook into the synthesis of the background paper. And this, again, is where there will be different views as to what should have different emphasis and so on. And so we would like to hear from you if you feel something is not only missing in these, but also in the way that they're framed and articulated, if there needs to be different emphasis within them. The next slide, please. I'll just deep dive a bit into what's in the background paper per recommendation now. So on investing financial resources, we say that adequate funds are important, but it's not necessarily high levels that are needed. It's not a huge investment, a huge cost, but it's important that there is enough. Stable and predictable funding is perhaps even more important than levels of funding because of that need for ongoing engagement in order to build that culture of participation. And diverse approaches exist in countries. Here we have 2 examples from Thailand about how to secure those financial resource investments and sustain them over time. So legal endorsement in Thailand's National Health Commission Office's statutory nature. So that's the organization that Nanook represents, and the fact that they are kind of legally mandated to function and facilitate social participation can help to secure resource allocation, but also earmarking. So in Thailand, Thai Health leverages a 2% surcharge on excise taxes on tobacco and alcohol. That means that there is a sort of committed ongoing allocation of resources to this agenda. And funding population, civil society, community participation in their capacity strengthening. Now, this is something that I expect will receive quite a lot of attention. It came up in the earlier comment as well about challenges of funding for civil society. And here we're talking specifically about the fact that ministries of health have a responsibility to ensure that they help to facilitate civil society to get the capacities they need to participate meaningfully in social participation spaces, mechanisms. Next slide, please. On strengthening capacities of government and participants. So it's important that you know, I think too often participatory mechanisms can be somewhat tokenistic, and for them to be meaningful, they need to be really thought about and planned carefully and executed carefully, so that those who are organizing and implementing participation are aware of and conscious and deliberate in the design and implementation to manage various challenges that will no doubt exist. Ministries often have good technical and medical expertise, but they lack the skills to design and implement effective mechanisms for participation. And skills such as how to identify, mitigate, and manage power imbalances and conflicts of interest are not explicitly there in most trainings, sort of approaches for medical staff, and they're something that I think takes particular attention and expertise that we shouldn't take lightly. Also, the value of experiential evidence. Now, that isn't, again, something that is traditionally valued in medical science, I think, and here we need to raise awareness and understanding of the value that comes from people's lived experiences and how that needs to inform the decision-making along with other types of evidence that ministries of health make in how to design and plan and implement their priorities. Ensuring community voices influence policy and processes, because what we find is that not only can sometimes this can happen, you can have participation, but it doesn't necessarily result in anything. So what? And so you might have participatory spaces where you have the voices of communities heard, but they're detached from the decision-making sort of process in government for policy or planning. So how do you really empower those who are managing these spaces to know how to influence the broader or higher level decisions that are being made? And there are huge costs of inadequate participation. So I think part of the capacity strengthening is recognizing what the cost of inaction on this is, and the mistrust, the misinformation, and the low compliance we saw during COVID response as a result of low levels or inadequate participation. Long-term sustained capacity strengthening is an important factor, because we obviously know that turnover can be quite sort of rapid in Ministry of Health staff. So how do we deal with that as a challenge? And facilitating the capacity strengthening of people, communities, and civil society so that they know their rights, they know how to represent their constituencies, how to build coalitions, how to have technical literacy, and the right kinds of communication skills to articulate their points well and be heard. Next slide, please.
Lara, just only a couple of minutes left.
Sure, I'll go a bit quicker through these last two. Thank you. So ensuring sustained and regular rather than ad hoc, as I'd mentioned a couple of times, what we're really looking at is to foster a culture of participation with regular and continuous engagement throughout the cycle of health policy and planning. Building relationships is important, and this happens only over time with mutual understanding, respect, and trust. Institutionalization is important to go beyond individuals into kind of institutions, and so that this doesn't change as soon as somebody who is a champion of this moves on. And it takes time to have effective and meaningful participation, so protecting that in the processes for decision making. Legal frameworks come up in this recommendation, but also in others. So here, mandating a specific entity like the National Health Council in Portugal, or like we saw in Thailand, the NHCO, can help to sustain this over time. The next slide, please. And finally, monitoring and using the data. So quality of participation is important. It's not an easy thing to monitor. Nanook mentioned this, like we're aware very well that it's not being done. Things are being done, and WHO has started to explore this by doing a systematic review of indicators being used. But what we've found is that it's not being done in a kind of coherent or of sufficient quality to look at the quality of participation, to look at the impact on decisions made. And this is something that we really think needs to be ramped up moving forwards. And targets and milestones are also really important factors to consider, because they help with accountability and holding governments to check on reporting with progress and how they're going to assess that progress. So I think I'll finish there with just a couple of prompting questions on the last slide. Do these priorities resonate in your country, and are they the right proposed actions? Is anything missing? How would you prioritize these actions? And do you foresee any sensitivities? So those are just triggers really to hear your thoughts, but thanks again for your time and attention.
Terrific. Thank you, Lara. And you've set the scene well for the remainder of the meeting. And we were thinking about framing the next half an hour around the priorities that have been highlighted in the report. And so how we'd like to run this, the remainder of the session is we have 5 poll questions for you all, very simple responses, just to kind of get a temperature check from you on overall to Lara's first question, do these priorities resonate with you? And then specifically each of the 4 that have been discussed just now. And then we'll have about 5 minutes or so of discussion time for each of those priority areas and try to probably get 1 or 2 or 3 comments from the floor, either in the chat or if you'd like to come on off mic and ask in person, that would be very much welcome. So Claudia is working these polls, I think. So hopefully question 1 has popped up for you around, do you agree with the priority actions? Fairly strong consensus there that they're in the right ballpark. We'll just, let's see if a few more come in. This one's mainly to warm you up. Great, I think it's plateauing out now. Can you all see the results on your screen? I'm not sure if...
No, we can.
Okay, great. So let's assume then that the way they've been framed are broadly, there's reasonable consensus in the room. Of course, we haven't got everyone responding, but that's helpful. So now we'd like to move more into the specifics, and the first one around the financial resourcing. And do you think that what we're really interested here is in your context, in either in the countries that you're working in or the work that you're focused on, to what extent would you say in your specific context there are adequate, stable and predictable financial resources for social participation? So Claudia, if we can go to the second question, please. So we're talking about your specific context here. And whilst that's coming on, I noted in the chat there were a few interesting comments about earmarking budgets, earmarking a fixed percentage share of overall budget allocation for participation processes and monitoring of services. That's a really important comment. And I think another one from Catherine about just the importance of basic funding to support participation, and that shouldn't fall on the shoulders of civil society organizations to bear that budgetary burden. So Again, a fairly strong message coming out on the poll here. I would like to open the floor for discussion, and if anyone would like to make a comment either on their own context or a question to our speakers, that would be most welcome. And Orijit, you've got a question or a comment.
Maybe I can talk about the experience or example in Thailand. Since I'm working in government before, and now I'm work in the civil society or NGOs, and I can see the picture that, for example, in Thailand, we have the regulation, or we can say regulation. The government budget can support or can support a little or cannot support to the civil society or NGOs. Since it is a regulation or a law, maybe Nanut, you know better, but I don't know whether your organization you can support or not. But for the National Health Security Office, before we support, and then later we have the what you said, the auditor authority, something like that. Is a government, and they come, and then this is some story that I can tell you. They come and they comment that NHSO, I mean National Health Security Office, by the time we work with so many civil society or NGO, they said that the budget of the National Health Security Office cannot support to NGO because.
Can we get response from Nanut on that point?
Yeah, but we are in different office, nah? But how her office can support, I don't know. But this is from the auditor authority that they can say no, cannot.
So I think the question is, are there regulatory restrictions on how governments disperse budgets, and are there actual barriers there in being able to fund CSOs for social participation work in the Thailand context?
My organization can support civil society to work, even supports NGOs to attend the World Health Assembly. But I know that this is, I'm talking on health sector. Yes, we support and we value civil society and NGOs. But on the other perspective, from other sector, for example, as Kun Orijit mentioned about finance ministry, that looking in different angle of civil society and NGOs, you know, so we always have to explain other sector, let's say financial sector, to understand the role of civil society and NGOs in policy development process.
Yeah, that's a super important point. Thank you. Yeah, so it's finance and treasury that often need convincing. We have a question from Anthony.
Yeah, I insist on two things. One is a legal framework in the policy of a fixed percentage, say even if it is 2% or 5% of overall budget for process of monitoring and assessing client satisfaction in the delivery of every services, number one. Number two, the investment in the community leaders in capacity building and planning the program, monitoring the program, is that investment stays with the community. Whereas bureaucrats and policymakers keep changing, they get transferred. One bureaucrat is so convinced will initiate a program, by the time the political leadership changes and it is gone. So whereas the investment in community leadership stays there. So that is the justification for investment, and there should be a legal framework for a fixed percentage for social participation and community leadership involvement.
Yeah, great points. They're really well made. Thank you very much. Elliot?
Thank you very much. One point about the experience of DRC here. In DRC, we have the community health workers who are the sample of social participation in health programs. But my question will be to the representative of the World Health Organization. What is the advocacy of the WHO about those community health workers who are not paid? They must be paid so that they do well their work. That is my question. I don't know if it is clear. Thank you. Over.
Yeah, so the question is around adequate remuneration for participation, not seeing it as volunteer work. Would Lara or Nano, would you like to comment on that?
Well, I think there is a distinction as well about participation being remunerated or community health workers being remunerated, because community health workers have different kinds of status in different contexts as well. In terms of remunerating participants for their participation, I think it's very variable how it's done, but I think the point that we've heard in other consultations that particularly for vulnerable and marginalized representatives communities, their time is very tight. The burden on them is large, and they just expecting that they can just take time out to participate and perhaps even have to travel to participate in a participatory mechanism is unrealistic. So I think it's heard that needs significant consideration and some sort of financial support. But I'll hand over to Kira, if I may, to add on to that point.
Actually, do you mind if we park that, Kira? I'm just conscious of time, and we do want to go through these other questions. And Christina, I can see your hand up. If it's okay, if you could post your question in the chat, because I'd like to just move on to question 3, which is around capacity strengthening. And again, the question is, in your context, to what extent would you say governments in your country or the context in which you work have the capacities to design and implement meaningful social participation for health, such as managing power asymmetries, etc. So if we can get just a sense from the room around to what extent you think that governments have these capacities, that would be great. And then we'll open up again for more discussion. And whilst that's happening in the chat, Inayat has said, I think capacity strengthening for communities is very important for social participation and health, even within active social movements. Community action on health, especially advocacy with the health system, remains limited. Also important to lay down mechanisms for civil society groups and communities to be able to monitor the implementation of outcomes of participatory processes. So that's very much on message here. Again, I think we're leaning towards a sense of capacity is limited in the contexts in which you're working, not quite as extreme as the previous question around financial resources. So again, if anyone would like to come off mic and make a comment or a question, that would be appreciated. And if not, Christina, if you still have your question from previously, we can come back to you.
Thank you, David. It's not actually a question, it's maybe point of, let's say, clarification. In terms of youth participation, especially internationally, it's very difficult for us to participate, engage, and travel, and actually have the diversity of representatives of each international organization. I'm currently the president of International Students One Health Alliance and also a member of the WHO Youth Council. And even in the Youth Council of WHO, we do have some difficulties attending the World Health Assembly or any other related event because of financially budgeting and stuff, and also because of visas, that because some countries, some individuals, some representatives of WHO, Youth Council, we do have some restrictions. So I'm not sure yet how we can work on that issue, and are there any suggestions from country leaders that we can implement, or we can at least propose to other member states and help ourselves? Yeah, so that was my point. It wasn't actually a question. Thank you.
Yeah, although it would be great to get a response maybe from our panelists around that, around strategies to overcome the many barriers, one of which is, as you mentioned, around funding barriers to have a seat at the table at these various fora, both in global events and nationally. So keen for comments from Lara or Nanut on that. Nanut, I think you're ready.
I'm not ready, actually, but I think it's difficult to answer. But first of all, they have to value this investment first. For National Health Assembly, we invite the National Youth Council and IFMSA Thailand to attend as a constituency, so they can drive the agenda, they can raise up their hand and speak. And because we value them as an investment of the new generation. So if the other countries see the value, especially youth, for their country, definitely they should secure money to send their youth to attend the WHA, or just the capacity building just to observe the WHA. And this is what Thailand has done to include young generation, even though they are at the Ministry of Public Health, but they are just like 30 something to attend World Health Assembly we see World Health Assembly as a school, global health school, like that. I'm pretty sure that if Thailand can have a chance to talk with member states on these issues, how to invest your country and how to see World Health Assembly, not just the policy, health policy, but the global health school for youth. We're happy to contribute this insight. Thank you.
Thanks, Nana. And just there's a question for Lara or Kira from Faith. Is there a way that WHO knows that countries have established institutions like the NHCO to facilitate SCO participation?
I can maybe come in on this question, David. Just maybe to mention, in the handbook on social participation, we've featured 9 country case studies from across the different WHO regions. So the Thai National Health Assembly is, for example, part of it, but also the Portugal National Health Council, the experience of Tunisia with their dialogue societal for health decision making. We have also India, Madagascar, Mexico, Burkina Faso. So we have different participatory governance approaches. Again, there are a lot more out there, and I think we are working with our regional offices and country offices in order, of course, to provide the support needed in order to strengthen those. There's not a global list, and I think that was maybe the question, on all of those different mechanisms, but we are certainly engaging very much and would like to engage with more partners in order to build and support those participatory mechanisms over time. Over.
Great, thanks, Kira. Let's move to the 4th question, which is or the priority area around, to what extent would you say social participation in your country or the context you're working in is regular and sustained over time. This is one of the other priority recommendations in the technical background paper. So this is about sustaining and maintaining participation. And whilst we're waiting on that, just checking in the chat, another comment here from WHA Health. I think through implementation of social participation mechanisms and monitoring and evaluation of this, the ministries of health will appreciate the value of participation. And this is part of building a culture of participation over time. So this is I guess a comment to this question around culture change and sustainability by continuously making the case for support. So again, we've got somewhat 40% here and 50% saying very little on sustainability mechanisms. Again, if anyone would like to make a comment in more detail, please come off mic. We're maybe a little glass half empty, so anyone who feels that they've got some examples where it's working well, that would be great to hear as well. No comments there. Okay, and I think we're getting close to saturation here on the poll. Perhaps we'll move on to the final question, which is around, well, picks up on this point again around monitoring and evaluation. So again, to what extent would you say social participation is monitored and the data are used to evaluate participatory processes and their impact? So some very clear signals here around that, similar to the financing question. We're seeing a lot of participants consider this as not well done. And Susanto has just posted around community or any target beneficiaries are mobilizing in terms of time, kind, and support to program, and taking ownership in program is social participation. Yeah, that's great. And I think that resonates with a nice comment earlier, way earlier in the chat around this notion of changing the paradigm shift around I operate and you cooperate. I thought that was really well said as well. Okay, comments, Anthony? You have the floor.
I just want to say the biggest obstacle in social participation is the attitude of the so-called technocrats and the bureaucrats equally of the bias towards community participation is a waste of time and it's a waste of energy. We know better to plan it, what's good for you. So that has to change.
Great, thank you. And just before we go to Kira, there's a question in the chat from Inayat. I had what may be a very basic question, but is there a distinction between social participation versus community participation? If the former includes the broader ambit of civil society groups, CSOs and NGOs, then how does one ensure a balance between participation spaces having adequate representation of communities themselves? A really interesting question there. Anyone like to tackle that one?
I'm happy maybe to start and then pass it over to some others. I think that's a very good question. I think we've used, and maybe to give some context, we've used social participation, and I actually invite everybody who's interested, especially to look into chapter 1, where we put out a couple of definitions and common terms that has been used. We looked at it from a governance lens in order to make the case that it's very important to bring people's voices and amplify people's voices within decision-making processes. So very much that uptake to policy and decision-making processes, where I think we certainly reached out to many different experiences, especially, for example, from the HIV experiences on community engagement, which potentially at the beginning very much was looking at delivery of services and how to improve it. But certainly there are very much overlaps. And I think across the different countries, as we have seen it as well, terms are slightly different and are used with different interpretations depending on the country context. My other point, I think, on representation is extremely important to check that you, depending on the policy question that is out there, that you have a good mix of representation, right? That we are having community leaders, what we've just heard from one of the participants, but also civil society organization. There might be bigger NGOs, there might be also local civil society or community groups. So it's important to reach out to a broad range of actors and voices within all walks of society. And for that, we may need to consider using different mechanisms and approaches in order to reach them, especially those who are usually left behind or with less voice and influence, in order to provide those safe spaces, in order to have those meaningful engagements so that everybody has the possibility to contribute and influence those spaces. And since I'm just speaking, maybe I just allow myself to put one comment forward on the monitoring. I think this is extremely important, and I think it's an area that is very much evolving. In WHO, we have also now done a literature review on what's actually out there, whether social participation is being measured or not. We're hoping that the publication will be out soon. I'm just sharing in the chat box for those who are interested a webinar link that we have done recently, just in order to delve into it. And certainly with the resolution and those processes and the consultation, I think understanding a lot more what is currently going out in those different participatory processes in terms of monitoring, in terms of evaluating, is certainly an added value in order to then improve those mechanisms. And certainly here again, check who's participating, but also who's not participating, in order to then reach out to those who are usually not heard and may have higher barriers to social participation, as we are very well aware that that exists. Over to you, David.
Thank you, Kira. That's great. We have Rafe, your hand's up. Sorry, we'll come back to you, Anthony. 1 minute.
Yeah. Yeah, thanks. I was just making a point that our societies are not homogeneous. It is divided on the lines of religion, caste, class, and all. So there are mechanisms within the government systems, like we have village health, nutrition, and sanitation committees, but they're not empowered by organizing. So we need to empower them by organizing them, those kind of committees. And I also wanted to make a point that we also need to focus on, from the governance point of view, local self-government. And both in urban and rural context, we need to empower the standing committees or whatsoever small committees which look into the health and nutrition and sanitation aspect. And there, I guess, a lot of work needs to be done, especially I'm talking in the context of India. Panchayati Raj systems and urban local self-government needs to be empowered through capacity building, and also by organizing these smaller committees. Like we have smaller committees within health system, within education system, within nutrition systems. If you empower them, organize them, let them know their powers and duties, they would act along with the systems to address the local issues by themselves. And that's what we want. We don't want the society to stand against the health services delivery system. We want them to work together and deliver, improve upon the delivery system. So that's where I guess 2-3 things, not just NGOs and CSOs, but we have, when we say communities and social participation, we need to also bring in the organizations like self-help groups, Panchayati Raj institutions, and all those aspects. And there, I guess we have a lot of scope to work and a lot of potential also to deliver. Thank you.
Yeah, they're really good points. And the Village Health, Nutrition and Sanitation committees are an excellent example of that local government mechanism.
Yeah.
We've only got 5 minutes, so Anthony, just a quick comment.
Just a quick comment. Most of what I wanted to say, Rafa has already stated, so that saves time. But what I wanted to say, in a global understanding, social participation means immediately jump onto NGOs and civil society organizations, and they are experts in writing beautiful donor report international funding. But make a difference from what do you mean by communities. Communities are very much down below, and user groups. They are the local people, and they have got two mechanisms. One is on their own, they come with initiative and leadership. Number two, with an established legal framework in India, as Rafa has mentioned, as village health and sanitation committees, and local self-government called each ward or neighborhood. They've got a representative which is elected and it is formalized. So strengthen those, and that is much more penetrable and from the grassroots. So we must focus on the representation from there. That's my point. Thank you.
Yeah, excellent point. Great. Look, I'm sorry, we could keep going for a lot longer, but I'm just going to maybe put it back to Lara and Nanut for any reflections on the conversation that we've had. It's been a really wide-ranging set of contributions, and I thank you all for that. So we'll give you the final couple of words, and then I'll hand over to Laura.
Because we have discussed on monitoring, and I think this is something missing in social participation. It even missing in community engagement or community participation, and missing at the global level as well as the national level. So I think if we can have the resolution on this issue, we should have mentioned on monitoring framework, and we can mandate the WHO to develop a monitoring framework and request countries or member states to report the progress to the WHA. So this is what we have here. This is why we bring up civil society for this agenda. Thank you.
Thank you. That's a great comment. And Lara.
Thanks, David. I'm not going to try and reply to the individual comments because there's been a lot and it's very rich, and we will treasure your feedback and go into the detail of it. And so thank you. But I also plead where there have been brief comments made, do elaborate on them, either in email to us or through the survey, because I think that a bit more detail helps to understand better what you're saying. And sometimes the brief comments in the meeting chat are very macro and hard to unpack in specifically how you want them to affect the document, for example, and the priorities as laid out in that document. So the more specific the feedback, the better. And please note the deadline is the 25th. So it's more a plea to please continue to engage and send more detailed feedback in writing. But thank you again.
You might have stolen Laura's fire there. I think that Laura's going to speak to that. But thank you all very much. It is hard to pack all this into a 1 hour discussion, but I thank our speakers, Lara and Nanut. That's been great for setting the scene, for giving us an overview of the technical background paper, and to all of you for your inputs via the poll and the chat and the comments. We've covered a lot, and as Lara said, it would be great now to go deeper into those comments and get more depth of understanding of the points you've been making. So I'll hand over to Laura for the final comments.
Thank you very much, David, and thank you, Lara, Nanut, and Kurt, for your intervention. And I'll try to be really quick on that, as we are a bit behind of time. But it's so interesting to see so many comments from your side. In fact, the main challenge in social participation is also to be representative and to reach out to people who are most marginalized and left behind. So in order to get some more feedback and complete feedback, I will just jump in on what Lara said about the survey. So it's closing on the 25th, so on Sunday. So yeah, please, we are welcoming any feedback. The more we get, the better. And another news, you are the first to know about that, but we are launching an advocacy brief for civil society organization community to be used to engage more in the process of social participation. So in this paper, it's only 4 pages. We want it to be really like short, to be easy to use. You will find some background information we mentioned over this webinar, some key advocacy asks, and also lots of tools to trying to empower everyone who wants to participate in the process to engage toward the national leaders or the global leaders. So we are going to share with you the link. You also have an email at the end of this meeting with many links we are also sharing. Claudia, please, I think it's the next slides. And so there will be many resources available, and you will be able to find some information on the civil society engagement website. And I think I didn't introduce myself by saying that, but I'm actually the Advocacy and Communication Officer at the Civil Society Engagement Mechanism. And we are always keen to get some more communities, NGOs, and people on board. So please register also to our listserv to be part and to be aware of our news by email and on our social media. And I'm also working with WHA, who is co-hosting the CSM with the MSH. So on these few words, I thank everyone from your participation, especially also Nanut for mentioning the willing to have more transparency in WHA process. And so we are all welcoming more information on how civil society can actually engage. I think one of the panels was really insightful on that, is that with sharing more information and organize people, we can definitely have a better participation for civil society. So I think I will end my point there. Thank you everyone for joining, and I let the floor over to you, David, for the closing.
Nothing more from me. I think we're just a couple of minutes over time, so thank you all very much for staying with us and covering these comments. Please do go to the links, and if you feel like commenting on the technical background paper via the survey link, there's a lot of resources in the chat that we'll disseminate. And thank you very much for your time. We'll close the meeting now.
Bye-bye.